Hi, everybody. I'm Dr. Ellie Stein with your video tip of the month for May 2025. It is called How to Cope Emotionally with Chronic Health Conditions. This tip is about how we think about and respond to the multiple complex challenges of having a chronic disease. Now, the reason it's important because how we think about our situation, our mindset, and how we respond to our situation can make a huge difference to our experience, our quality of life, and if we're lucky, even our healing trajectory. In this video tip, I will walk you through how to shift from surviving in anger and grief to moving forward towards new ways of being, including ways you may not have conceived of yet, right? So you don't know what those ways are. You're courageously putting one foot in front of the other and brave enough to see where you're going to end up. The goal of healing, in my opinion, is to move forward, both with the biomedical realities that you face, and they're different for each of us, and the psychological and emotional challenges. For over 20 years, I've used a model of coping and coming to terms with illness that was developed by Patricia Fennell. She is an MSW social worker. She made her model with MECFS in mind, and it is generic and useful for people with a wide range of chronic health conditions. Anything that's severe enough to cause significant crisis and loss could benefit from this way of thinking. Fennell has written what I consider a classic book called The Chronic Illness Workbook. It's written in plain language and is filled with useful exercises to get you thinking differently about your situation and identify your priorities now that your life has changed forever. So what is the Fennell model for coping with chronic conditions? There are 4 phases. They're loosely based on the work of Elizabeth Kubler-Ross. Many of you have heard of her. She came up with the 5 stages of grief, starting with denial, like this can't be happening, and working through to getting to some kind of acceptance. Now, in Kubler-Ross's work, she's mostly directing it towards people who have lost a loved one. So the loss is known and final. Living with chronic disease can be more complicated because of the uncertainty. You never know what's going to happen next. The landscape is always changing. Living with chronic disease is a marathon, hopefully a long one, right? Hopefully you've got a lot of years ahead of you. So the good news about this is you have time. You don't have to figure everything out this week or even this year. And what I've experienced is there's many phases of growth. You can't rush it. Each of us move at our own pace. The goal is to get to a place where you experience acceptance, feel peace, and believe it or not, can even view or notice or see some benefits or even blessings from your illness experience, rather than focusing on and recycling the losses and the limitations. So I'm going to walk you through the 4 phases. I would encourage you to go through this really, really slowly. Grab a workbook, blank, with a bunch of pens, maybe in different colors. I'm very big into multicolor writing. And after each point that I mention, consider pausing the recording and writing any thoughts or reflections you have about how that point pertains to you. Some you will really relate to, and maybe you'll write a couple pages. Some will not be relevant, and feel free to just move right on. Write whatever comes to mind. Don't be neat. Don't write within the lines. Don't pretend that your 2nd grade writing teacher is going to be marking this. Add images, scribbles, cartoons, thought bubbles. Don't censor yourself. No one needs to read this other than yourself. So the first phase is called crisis. This happens when anybody experiences a sudden onset or worsening of symptoms. Now, in the case of ME, FM, long COVID, chronic Lyme, MCAS, etc., the onset of the illness is often not the crisis point. This is because when you first get ill, you generally think there's an easy solution, right? And you go to your doctor expecting them to run some tests, make a diagnosis, and lead you on a path towards improvement. The crisis comes when this doesn't happen. You've been to your healthcare team, maybe multiple times. You've had tests, you've had consultations. It's not helping. You haven't been given the advice you need. You're not getting better. And the penny drops. Oh my gosh, this might be more serious and more chronic than I imagined. At the point when you realize you're in a crisis, there's confusion, fear, and a loss of sense of control. That's the definition of crisis. You have no idea what to do. If you know what to do, be grateful, means you're not in crisis and you're moving on to the next step. Now, with each of these phases, Fennell has a motto, kind of something to keep in the back of your mind to help you through it. And the motto for phase 1 is treat yourself with compassion, right? Acknowledge the shock and fear you may be feeling. It's normal. So this is a point where you could pause, if it's relevant, and do some writing about the shock and fear that you have experienced and maybe still be experiencing. Point 2, seek medical and emotional support rather than trying to tough it out alone. The support may or may not be there, but you won't know until you try. So I strongly recommend reaching out to your most trusted friends and healthcare advisors and seeing whether you can get some practical strategies at the very least to help you with some of your most difficult symptoms. Rest and allow yourself time to process what's happening. Again, this is likely to be a marathon. Your mind and your body need care and will help you through this more effectively if you look after them and let them move at their own pace. Very important, next point. Again, you could be pausing in between each of these. Avoid self-blame. Chronic illness is not your fault. Even if you believe in retrospect that you made a mistake, something in your self-management, some healthcare decision, which you believe has contributed to your current situation, you did the best you could at the time. If you had known what you now know, possibly you would have done things differently, but you didn't. I certainly can relate to this. I've made a bunch of errors in my self-management and my healthcare, and I have suffered for them. And I continue to work on telling myself it's not my fault. The way to move past the crisis phase is to get the support you need. And at this phase, because this is new and you really have no idea what's going on and what the best course of action is, most of that support is going to come from the outside, including the internet. My only caution with the internet, there are some incredible, amazing sites out there with detailed, very accurate information. But remember, right now you're in crisis. Pace yourself. You can only take in a certain amount of information. Try to stick with the 30,000-foot view. What can you do to support yourself? Make sure you have a place to live, enough food on the table, some secure relationships to lean on. That's what you need to really focus on in the crisis phase. As you get some of that support in place and you're not flailing quite as much, you may be fortunate and move into what's called the stabilization phase. That's the second phase. So in stabilization, you realize that the illness is persisting. And so you start recognizing this may not be temporary. and you need a longer term plan. So short-term plans that you might have put in place in crisis may need to change to get through stabilization effectively. So you begin searching more in earnest for treatments, explanations, and sources of support, learning how to adjust to your new circumstances. This phase can take a really long time. It can take months to years. So if you feel you're moving slowly, again, the motto of this phase is treat yourself with patience. Some of the tips of this phase: accept that you don't have all the answers yet, right? You're human. This is new. You can't possibly figure it all out really quickly. It takes time to experiment. So even if you read some great advice online, or you're fortunate enough to have a skilled, helpful healthcare team member, we're all different, and the advice that you read or get may or may not work for you. So there's a lot of trial and error in this phase of stabilization to figure out what works best for you. Allow yourself to grieve your losses, things like changes in your abilities and lifestyle. One of the things people grieve the most is change in cognitive function. It's really hard on one's self-esteem to not be able to learn and remember and fluently converse and debate with, the people in your life, and respond quickly and be an active part of conversations. Many people lose that skill. Grieve it. Allow yourself to feel sad and frustrated. It's a big loss. Again, pacing shows up as it does in every single phase. Pace yourself. There's so much to do, so many supports to get in place. There may be lots of forms to fill out. You may need a disabled parking form. You may need to apply for disability. There's a lot going on. Avoid overexertion as you adjust to your new limits. Spend some time learning about your condition. Again, trying not to become too overwhelmed with the amount of information's out there. Try to find a couple trustworthy sources. They may be friends who have gone through something similar. They may be websites. They may be healthcare professionals. Try not to kind of go everywhere at once, right? Focus on the advice that you can relate to, that passes kind of the test of your intuition. And lastly, be gentle with yourself when experiencing frustrations or setbacks. I mentioned this phase of stabilization. You're trying out a lot of things, trying to figure out what's going to work the best for you, and not everything is going to work. No matter how smart you are, no matter how brilliant your sources of support and advice are, some things just aren't going to work. It's going to backfire. You're going to have setbacks. That's part of the process. So be gentle with yourself. The third phase is what Fennell calls the psychological heavy lifting phase. It's when you go through grief. You realize, it's called resolution. Phase 3 is resolution. So it's when you grieve and resolve the changes that have happened to you as a result of your illness. And you start integrating some of the illness experiences and learning into your identity. You tentatively toy with accepting your new reality for short periods, but you still experience significant ups and downs. And the emotions are challenging. In this phase, it's advised to treat yourself with flexibility. Redefine success in a way that acknowledges your new reality. So if your definition of success was working a certain number of hours, earning a certain amount of money, supporting a certain amount of people, cooking amazing, culinary extravagances for holidays, etc., and you try to continue with that definition of success, you are going to crash, right? So again, pacing comes into it, but redefining your goals and your values will help you pace. You want to develop new self-care routines that support your physical and emotional well-being so that you don't have frequent crashes and you stay stable. When you're stable, you can use your energy for the important psychological tasks of grieving and reevaluating your life and moving forward. Relationships are incredibly important. I've said, don't try to go through this alone. Some of your relationships will really come into their own. You'll say, wow, this person really understands, or even if they don't understand, they are acting in such a supportive way. I want more of them in my life. Other relationships may fall by the wayside. Some people, for whatever reason, may not be able to understand. Be willing to let some of them go. This is part of the flexibility involved. And finally, let yourself feel your emotions without judgment. So I mentioned resolution is where you go through a lot of the anger and the grief and the fear. It is normal, right? So don't judge yourself for that. In fact, celebrate that you're having full-on healthy emotions, because to the extent that you can fully feel them and resolve them, it's going to allow you to move forward. Now, the fourth phase is called integration. Elizabeth Kubler-Ross's fifth stage of grief is acceptance, and she stressed that nobody lands in acceptance as a permanent state. It's just not possible. Why? Because life is always changing. So it's the same with integration. For brief periods of time, you feel like you've arrived. I've had these moments and I kind of laugh at myself remembering them, because I'll arrive at what I now know to be a state of integration. And I think to myself, yes, Ellie, you've done it. All your hard work has paid off, and you're going to stay in this awesome feeling good state forever. Now, usually when I have that thought, it's minutes to hours later that something happens that tosses me back into an earlier phase, most often crisis, if I've gotten that cocky. So you will have brief periods where you've really incorporated who you were before and what you've learned through your illness experience, and you feel accepting, peaceful, and you found a sense of meaning and purpose despite your health challenges, which may be ongoing. So an important point to make is, as you're moving through these emotional phases, you can do this even if your physical health remains severe. So this is the good news. You're not tied to your physical health, and you don't have to be fully healed in order to get to integration. The motto of this fourth phase is treat yourself with respect. You have had such courage, such determination, such tenacity, such love and respect for yourself that you've gotten this far. You could have given up. You haven't. You've struggled through. You've learned how to look after yourself in the best possible way. That is deserving of respect. Honor your journey. You have gained wisdom and resilience. If you're doing some note-taking or journaling, I would pause right there and write down, what wisdom and resilience have you gained? What are the specific ways in which your illness has benefited you, even if you don't like many of the other aspects, right? Both can exist. If it's right for you, and you've gotten to this phase where you're more at peace, you may want to use your experiences to help others. I can tell you from my experience that sharing my story really helps give meaning to the struggles that I've been through, because I can let people know there is a light at the end of the tunnel. It can get better. Celebrate your strengths rather than focusing only or mostly on limitations. You have many. They are with you every day, and it's your choice whether you notice and acknowledge them or not. Advocate for your needs confidently and without guilt when you need to. Maybe A form runs out, you need to get it redone. Maybe you get cut off your insurance. Maybe you lose your understanding physician and you have to go to half a dozen meet and greets before you meet a doctor who's a good fit for you. Maybe you need to advocate with some friends to build in some weekly support. It could be almost anything. Don't feel guilty about asking for and trying to get what you need to live the best possible life. Continue your self-care and balance. So again, pacing. We are never so progressed that we don't need to pace. So ensure that you don't push yourself beyond your limits. That's the last tip. I ran groups in my medical practice using this model for over 20 years. And I have to tell you that most people, some relatively quickly, some over a prolonged period of 2 or more years, came to a better place emotionally. They found a new understanding of their situation. They developed more peace and acceptance. Some of the people who benefited from this approach did so despite skepticism, despite disbelief, despite a strong wish to keep fighting rather than accepting. So if you're attached to the fight, if you think I'm really full of it for promoting anything that will bring you to a state of more acceptance, it doesn't matter. It's still possible for you. Now, just one comment on the fighting versus accepting polarization, because it just comes up so often. Isn't it better, you might think to yourself, to keep fighting? Doesn't acceptance mean that you're giving up? In a weird paradox that I can't fully explain, but that is supported by many, many experts, the opposite is true. As the longer you stay in anger and grief, the more prolonged your suffering is. So by acknowledging your losses, by allowing yourself to feel the very painful emotions that those losses are connected with, you increase the chances that you're going to move ahead to a place where life feels worth living on a daily basis. Now, I am not saying this is easy. Grief is scary and can be intense. You may want to consult with a mental health professional or coach to help you through this, especially if you have a history of trauma that makes going through grief even more challenging. Yes, it takes courage. Yes, it takes perseverance. I can tell you from my own life and having worked with thousands of patients, it is so worth it. Now, as a final note, Fennell stresses that although it's very difficult, if not impossible, to see at first, the crisis of acquiring or developing a disabling chronic disease has opportunities as well as challenges. So if you've got a notebook out, this would be a great place to pause and ask yourself, what have been some of the opportunities associated with your health journey? Hopefully, you're able to think of some. One of the opportunities that many people experience occurs when pretty early in the condition where serious illness puts a hard stop to your life, right? It's like running into a brick wall. You just can no longer do the things you used to do. Perhaps you have had to stop work, stop volunteering, stop sports, stop family gatherings, stop travel, so many things that you enjoyed. Now, you may see that as just unipolar horrible. But some people, in the pause that follows the hard stop, use it as an opportunity to deeply reevaluate their life. What are your authentic goals and values? Who are the people that are most important to you? How do you want to spend the much more limited time and energy resources that you have? So my suggestion is, if you're in this pause, use it as an opportunity to focus your attention on the things of authentic interest to you. If you're severely ill, of course, moving forward is difficult. You may not see a way forward, and you may need to really call on your deep inner creativity. It is possible. A last tip. Have you ever heard the line, "When I am old, I shall wear purple"? It turns out it's from a poem called Warning by a now deceased poet, Jenny Joseph. She was British and she passed away in 2018. When I read the entire poem, I found it very moving and very inspiring. So I'd recommend you looking it up online. The question I want to leave you with is, the line in the poem is, "When I am old, I shall wear purple." And I take that to mean, when I'm old, I don't have to worry about what other people think. I'm going to wear whatever I want. And my question to you is, why wait to get old or to get healthy before you start living your most authentic, outrageous life? If you were to start the equivalent of wearing purple now, what would that look like in your life? So for a final writing prompt, what would your authentic self look like? And how could you start taking some baby steps along that path? I would love to hear your response to this video tip and what you've learned about yourself. What are some of the ways in which your illness experience has actually enriched your life?